Senator Franken. Director McSwain, you've been around from previous administration, current one, as you said, decades doing this. You know the agency well. I have a number of tribal resolutions and letters addressed to you, to others, seeking the removal of some specific IHS employees. And I know, Senator Heitkamp, you asked the specific question about doing this. The joint resolution was adopted by the Omaha and Winnebago tribes August 12th of 2015. It specifically identifies a number of underperforming IHS managers. As far as we can tell, these people have been shifted around the Great Plains area, many cases given pay raises, promotions, not fired, even though most of these people seemed to be directly responsible for the violations that were cited in the CMS surveys that we're talking about today. So I'd like if you could please just explain to the committee why these people are still employed by the IHS.
I would be happy to speak with you and not in this public setting, only because of personnel issues and privacy issues with the employees, but and perhaps even be able to provide a full response to that question. Okay. It's a good one. And I appreciate the question, Mr. Chairman, but we would need another forum to provide a response.
Well, no, I appreciate that and the confidentiality of workers and those issues, but it does highlight the concerns that all of us have on the committee about the ability to deal with problems when they exist. And if they can't be dealt with, how do we feel that we're going to be able to solve the problem? We've heard from some of our colleagues, money is an issue. We also hear about lavish expenses, that so much of the money that goes ends up at headquarters rather than actually spent to be taking care of people. And the number, you would be astonished how many heads in the audience are shaking yes as I say that, Director McSwain, and now the smiles that are coming to the faces because they know that that's the case. And so there are huge concerns about that. Dr. Carroll, I wanted to visit with you about one other thing. It was a December 4th, 2015 conference call with congressional staff, HHS, officials. It sounds like you almost brushed off, my report is that you almost brushed off concerns raised by the congressional staff about an incident described in one of the CMS surveys saying that, quote, if you only had 2 babies hit the bathroom floor in 8 years, that's pretty good. So I just want to be absolutely clear. You and I both took the same Hippocratic oath. We're both physicians. You have a professional duty, a trust responsibility, moral responsibility to our patients who are seeking care. I just want to, if you'd like to say anything about that and perhaps straighten out a record or clarify or say things to the folks that are here, including the young mothers who you referenced on the call and the tribes that were actually impacted by this.
Well, thank you, Chairman Barrasso. Yes, I would like to say something. I'm the Chief Medical Officer for the Indian Health Service. I'm a native, and I am 100% committed to the Indian Health Service. Those comments, totally unacceptable, really made, after a long day, we all work very hard, and I really am sorry that I made any reference to any negativity to patient care. My 100% priority is improving patient care, providing quality. It is my highest priority. Thank you.
Well, thank you. I want to thank anyone else